Spina bifida and cleft lip and palate are similar conditions in that they both involve a failure of certain tissues to fuse during embryonic development. In this short video, we hope to educate you on how each disorder begins and how it may manifest itself. We will begin with cleft lip and palate. Both of these defects happen very early on in embryonic development. In this photo, we can see the early formation of the face. Between 5 and 12 weeks gestation, the sections that make up the face come together. If we look at this color-coded illustration, we can see they fit together almost like a puzzle. If there's any lack of tissue or any failure of these tissues to fuse, a cleft can happen, resulting in a cleft lip. Cleft lip can manifest itself in a number of different ways. It can either be complete, going right into the nose, or incomplete, just involving the lip, and it can be unilateral or bilateral. The prognosis for children born with cleft lip are usually pretty good, involving a little bit of cosmetic surgery and probably some orthodontic work later in life. It becomes a little bit more complicated when the palate is involved. Let's take a look at palate formation in utero. Around 8 to 10 weeks gestation, the hard palate begins to form. The primary palate and the two secondary palatal shelves make their migration to the center. Again, if there is any disruption of this, a space or cleft can develop. As would be expected, a child with a cleft in the palate would need more aftercare. Usually the first surgery would be around 6 to 12 months, with the purpose being to create a functional palate. Keep in mind, children born with a cleft palate are usually born with a cleft lip as well. Usually these two birth defects go hand in hand. Now we will discuss spina bifida, another failure of tissues to fuse in utero, this time being the neural tube. This happens even earlier in gestation, at only 20 to 28 days, sometimes before a woman even knows she is pregnant. Here is a photo of how the spine forms in utero. As we can see in the picture to the right, there is a small hole at the bottom. Spina bifida literally means split spine. Spina bifida can range from almost completely undetected to severely debilitating. This photograph shows the three most common forms of spina bifida. Spina bifida occulta is the mildest form of the disease. It is characterized by a small gap in the spine but no opening sac on the back. This type is often not diagnosed as it causes no disability or symptoms. The second picture is spina bifida meningocele. This type has a sac of spinal fluid protruding out of the spine. It can have a wide range of symptoms, from none to complete paralysis with urinary and bowel dysfunction, depending on where the spine the deformity occurs. The last picture is the most severe form of spina bifida, myelomeningocele. In this condition, part of the spinal cord and nerves come through the open part of the spine. Most born with this condition have too much fluid on their brains as well and require shunts or multiple surgeries to correct the condition. Because there are varying degrees of spina bifida, there are varying degrees of prognosis as well. Some patients require lifelong care and multiple surgeries, others require no care at all.